कह देना नेट नहीं चल रहा था। तो देखो ना ये बड़ा इम्पोर्टेंट टॉपिक है, अब मैं इसको डर पड़ा, सायरा नीचे गई है तो चला है। अब इस तरह क्या करें हम? Assalamualaikum. Third year, I'm Professor Shahida Niazi, and today we are going to. I'm sorry, हमारा lecture time पे नहीं start हुआ है. Actually, the time was 10 minutes past 10, but there was a problem with the internet. So I'm sorry if we are late, but I will try to finish the lecture on time, and maybe I will have to take another 10 minutes. So today we are going to start with a very important topic regarding general pathology, and that is neoplasia. And the first lecture is an introductory lecture which mainly deals with the nomenclature of tumors. And I would like to emphasize that you should understand this lecture because the topic of neoplasia, because आपका fourth year में जितनी भी special pathology है, that is mainly based on tumors, and you will not be able to understand tumors in fourth year if you do not take a grasp of the neoplasia in this lecture. So neoplasia, the definition and the nomenclature and introduction. Neo, as you all know, means new, and plasia means formation. So a neoplasia, so a neoplasm is a new growth and an abnormal swelling which is known as a neoplasm or a tumor. And oncology is the study of tumors or neoplasms. So a tumor is an abnormal swelling or a new growth, and oncology is the study of these tumors. Oncos means tumor and logy is the study. And cancer means crab-like. So the topic of neoplasia mainly deals with tumors, which can be both benign tumors or they can be malignant tumors, and malignant tumors are known as cancers. And as you all know, a cancer is a crab-like structure. It adheres to any part, it sticks to that part, and it penetrates into it. So the definition of a neoplasm. This is very important. It is asked in the vivas that how do you define a neoplasm? A neoplasm is an abnormal mass of tissue, the growth of which is excessive. It is uncoordinated as compared to the normal tissues, and it persists even if the stimulus which had caused it, even if the stimulus is withdrawn, the growth of that tissue, it persists in the same excessive manner. So remember, it is an abnormal, neoplasm is an abnormal mass of tissue. It grows excessively. Its growth is uncoordinated, unregulated, and that growth is going to continue even after you stop the stimulus which had caused its proliferation. So tumors are autonomous. Autonomous means that they become self-sufficient. They keep on proliferating. They have unregulated and excessive proliferation. So autonomy means they are self-sufficient in all due respects. Tumors and neoplasms are monoclonal, which means that the entire population of the tumor is derived from a single cell. That single cell has occurred a genetic damage, or it has occurred a mutation, and non-lethal genetic damage. It should be a non-lethal genetic damage, which means a mutation. And then that progeny, that cell is going to multiply into 2 is going to multiply into 4, 4 into 8, and that is going to form a monoclonal cluster of cells which are tumors. So they are derived from a single cell. Number 3 point is that it is Neoplasms are abnormal masses. They are purposeless. They are useful. They do not serve any important or useful purpose in the body. They just eat on the host like a parasite. उसकी energy लेते हैं, उससे खाना लेते हैं, like they act as parasites. Now, tumors or neoplasms can be divided into two main categories. Benign tumors, which are the innocent tumors. They are the bland tumors. If you have a benign neoplasm, you will not die. A malignant tumor are the lethal tumors. जब हम word use करते हैं कि ये इसको cancer है, so it means कि जो उसको tumor है, that is a malignant tumor. So tumors are divided into benign tumors, which are the innocent tumors. They are the bland tumors, and they will not cause any harm to the patient, but they have to be removed, obviously. And malignant tumors are the frankly cancerous tumors. वो cancer होता है. All neoplasms, whether they are benign or they are malignant, they have two basic constituents. Number one is the parenchymal component, which is the cellular component or the epithelial component. And number two, they have the stromal component, which is the supporting part, that is the connective tissue support of the tumor. That is, we have a parenchymal component, that is the cellular component, and that is made of the proliferating neoplastic cells. And then these neoplastic proliferating cells, they need a scaffold in order to grow, and that is provided by the stromal component, which is mainly made up of connective tissue stroma. It comprises of connective tissue, blood vessels, inflammatory cells. Tumors which have an abundant stromal component, that is the fibrous tissue component, they are going to be hard. They cut with a grating sensation, and they are described as being serous in nature. इनकी फीलिंग जब इस वक्त हम काटते हैं बिल्कुल ऐसे होते हैं जैसे हम एक अनराइप पेयर होता है ना, उसको जिस वक्त हम काटते हैं तो गड़गड़ की आवाज आती है, तो they cut with a grating sensation. And those tumors which have an abundant epithelial cellular component with a scant stroma, they are soft and fleshy, and so they are described as having a medullary consistency. So hard serous tumors which have an abundant fibrous tissue component or the stromal component, they are known as serous tumors. And those which have a soft fleshy feeling on cutting, they are known as medullary tumors. And serous tumors are usually a component of malignant tumors, cancerous tumors. So desmoplasia means the presence of an excessive collagenous stroma. जो serous होंगे उनको हम कहते हैं they have an excessive desmoplastic stroma. And the increased amount of this desmoplastic stroma imparts a hard consistency to any tumor. And the presence of desmoplasia means that the tumor is malignant, it is not a benign. So the gross and microscopic features of benign. So now we have studied.
Ma'am,
जी जी बेटा जी, हाँ जी बताओ
न्यूप्लेजिया मेटाप्लेजिया का डिफरेंस होगा
जी, बोलो
नियोप्लेजिया मेटाप्लेजिया का डिफरेंस
बेटा, ये हम बाद में करेंगे. नियोप्लेजिया इज अ न्यू फॉर्मेशन. Metaplasia is the conversion of one adult mature type into another mature type. It is not a new growth. Neoplasia is a new growth. Metaplasia is the conversion of one cell type into another cell type. ये भी आपको my next lecture metaplasia, dysplasia की भी definitions करेंगे. So now we come on to the gross and light microscopic features of benign tumors. So the benign tumors, I told you, they are the innocent tumors. They do not kill a patient. Presence of a benign tumor will not harm the patient in any way except for producing any pressure symptoms. So benign tumors, the gross and light microscopic features, they resemble an innocent lesion of growth. On gross examination, benign tumors are well circumscribed, they are localized, they have a surrounding capsule. And the patient usually does not die of a benign tumor unless that benign tumor is causing pressure effects on a vital organ like it is producing a benign tumor of the brain is maybe compressing a vital organ, vital structures हमारे brain में mid stem में या कर रहे हैं, या हमारे जो motor areas को press कर रहा है, unless it presses on some important region of the body or the heart. Otherwise, benign tumors do not cause any harm. They remain confined, they remain localized. That is, they do not travel to another site. They will grow, but they will grow to their original site of origin. They do not spread or they invade the adjacent structures. They are well circumscribed, localized patterns. They usually grow slowly and they are well differentiated. They resemble the tissue of their origin. They are well differentiated. And benign tumors are likely to resemble the original tissue and also retain the function of the original cell of origin. And they can be completely excised on surgical. सर्जरी के साथ हम उनको पूरा का पूरा निकाल सकते हैं, बिकॉज उनके ये कैप्सूल होते हैं, हम कैप्सूल के साथ इसको इन्यूक्लिएट करके निकाल देते हैं, बिकॉज दे आर लोकलाइज्ड, they do not invade the surrounding structures like malignant tumors do. So the nomenclature and the classification of benign tumors. Now, benign tumors, they can be of mesenchymal origin or they can be of epithelial origin. आपको पता है mesenchymal tissues कौन से होते हैं और epithelial कौन से होते हैं, ये आप लोगों ने हिस्टोलॉजी में पढ़ा. Benign tumors of mesenchymal origin का हम nomenclature कर लेते हैं, ये कैसे करना है. For example, ये mesenchymal tissues है ना, fibrous tissue, cartilage, adipose tissue, osteoid, muscle, neural tissue. और इनके जो corresponding tumors इनमें से निकल रहे हैं, they are known as a tumor arising from the fibrous tissue is going to be known as a fibroma. और उसका जो malignant counterpart होगा उसको हम कहेंगे fibrosarcoma. कार्टिलेज का बिनाइन ट्यूमर होगा उसको हम कहेंगे कॉन्ड्रोमा और उसके मैलिग्नेंट काउंटरपार्ट को कहेंगे कॉन्ड्रोसार्कोमा. एडिपोज टिश्यू या फैट के ट्यूमर को हम कहेंगे लाइपोमा. बोन का ट्यूमर दैट इज ऑस्टियोइड के ट्यूमर को वी विल कॉल इट एन ऑस्टियोमा. A tumor originating from the smooth muscle is going to be known as a myoma, and a tumor originating from the neural tissue is going to be known as a neuroma or a neurofibroma or a schwannoma, and a tumor originating from the blood vessels is going to be known as a hemangioma or an angioma. So fibrous tissue tumor, fibroma, cartilage, chondroma, adipose tissue, lipoma, osteoid, osteoma, these are all tumors of mesenchymal origin. Now this is a lipoma. आप देख रहे हो ये orangish yellow सा है and it is well circumscribed. This is a typical light microscopic. This was the gross of a lipoma, surgically उसको निकाला हुआ है. This is the microscopic picture. This is composed of empty vacuolated fat spaces. आपने third year में fat cells की diagram बनाई होगी अपनी histology की. Now this is a malignant. I think we can skip this slide. These are liposarcoma. And this is another liposarcoma. इसमें जो empty spaces and that those are the lipocytes. ये आप छोड़ दो. These are now this is an hemangioma. ये एक बच्चे के कान के नीचे. This is a red tumor, elevated red tumor. This hemangioma is a tumor arising from the blood vessels. Benign tumor of vascular origin. This is the light microscopic pattern. ये जितने भी आपको round spaces नजर आ रही हैं, these are blood vascular channels और उनके अंदर red blood cells. So this is a hemangioma, which is a benign tumor of vascular origin. Now this is a uterine leiomyoma. Leiomyoma is a tumor uterus के अंदर. This is the commonest tumor और इसको हम layman terms में कहते हैं fibroid. ये यूट्रस है और इसके अंदर 1 2 3 4 5 6 1 2 3 4 5 6 7 8 leiomyomas हैं और 5 fibroids. This is a tumor of smooth muscle origin. This is the microscopic image of a leiomyoma, which is a benign tumor of muscle. ये muscle fibers आपको नजर आ रहे हैं, spindle shaped muscle fibers. This is the light microscopic picture of a leiomyoma. This is another light microscopic picture of a leiomyoma composed of spindle shaped muscle cells. Now this is a leiomyosarcoma, the malignant counterpart. इसमें आप देख रहे हो कि cells कितने गंदे, ugly looking cells हैं. You need not go into the details. ये giant cell. This is a tumor giant cell. ये मैं आपको बाद में जब malignant tumors के हम करेंगे तभी. लेकिन just for comparison, I've put this figure over here. This is an abnormal mitosis, and you can, if you compare this figure with the previous one, this is a leiomyoma, which is a benign tumor, and this is a leiomyosarcoma, very ugly, hyperchromatic, dark staining, huge cells, and this cell in the center is a tumor giant cell. This is mitosis, abnormal mitosis. This is another mitosis. ये हम बाद में दोबारा. So this is a chondroma. Chondroma is a benign tumor of cartilaginous origin. Chondroma आप लोगों ने chondrocytes देखे होंगे histology में कि लेक्यूनी होते हैं, D-shaped लेक्यूनी होते हैं और उनके अंदर एक सेल पड़ा. This is a chondrosarcoma, which is a malignant tumor of cartilage. ये भी हम बाद में दोबारा करेंगे. Just for comparison, this is a chondroma, bland-looking tumor. It is a benign tumor. This is a chondrosarcoma, which is a malignant tumor of cartilaginous origin. This is another benign chondroma. The chondrocytes हैं सारे. ये सारे chondrocytes. Lacunae containing chondrocytes. Now the classification of epithelial origin tumors. पहले हमने classification की है of mesenchymal origin tumors, fibroma, lipoma, hemangioma, leiomyoma, neurofibroma. Those were the benign tumors of mesenchymal origin. Now we come on to the nomenclature of the benign tumors of epithelial origin, and the nomenclature of the epithelial origin is a bit complicated as compared to the mesenchymal origin tumors. It is based, अब हम 3 parameters पे उसकी classification को base करते हैं. According to the cell of origin, according to the gross appearance of the tumor, and according to the microscopic pattern. So the cell of origin, which is obviously a cell of epithelial origin, the microscopic pattern, which we see under the light microscope, and the gross appearance of the tumor, that is the macroscopic image, which we see under the with the naked eye. So we have a benign tumor. इसके different types: adenoma, papilloma, polyp, and a cystadenoma. Adenoma is a benign tumor forming glandular structures. So a benign epithelial tumor forming glandular structures is known as an adenoma. Examples of adenoma is a fibroadenoma of the breast, an adrenal adenoma, a renal adenoma, a kidney adenoma. Hepatic adenoma is an adenoma of the liver, colonic adenoma, a thyroid adenoma, a pituitary adenoma. So adenomas are benign tumors forming glandular structures. A papilloma is a thin finger-like warty outgrowth. बिल्कुल उंगली की तरह, it is a finger-like warty outgrowth, and it is visible both microscopically as well as grossly, and it projects from an epithelial surface. For example, skin में papillomas होंगे, फिर larynx के अंदर हमारे papillomas होंगे. These are papillomas, thin finger-like warty outgrowths. अभी आपको मैं इनके grossly दिखा दूँ. Then we have a polyp. In contrast to a papilloma, which is a finger-like growth, a polyp is a rounded, nodular, polypoidal structure. It is grossly visible. Both papillomas and polyps are grossly visible, nodular structures, ball-like. They project from a mucosal lining surface, and they project into the lumen of a hollow viscus or cavity. For example, colonic adenomas हमारे होंगे, मैं आपको pictures दिखाऊंगी. Now adenomas, दोनों में फर्क ये है कि ये finger like वाटी होते हैं और ये rounded ball like polypoidal. And polyps, they can have a stalk. Those are known as pedunculated polyps, or they can be sessile, which do not have any stalk. Pedunculated polyps की stalk होती है और बिल्कुल mushroom shaped outgrowth होती है, और जो sessile होते हैं वो बस वैसे एक nodule की तरह protrude करते हैं. Cyst adenoma, cyst होती है cavity, cyst adenoma or a papillary cyst adenoma is a benign tumor which has a predominantly hollow cyst-like cavity, and that is filled with fluid, and it has an epithelial lining. And most commonly you see these cyst adenomas or papillary cyst adenomas in the ovary. So all ovarian cysts, especially the benign ovarian cysts, are cyst adenomas. They are cyst adenomas. So this is a gross image of a fibroadenoma. Fibroadenoma is the commonest benign tumor of the female breast. It is the commonest benign tumor of young females. This is the gross and this is the light microscopic image. You can see that this is because it is a benign lesion. It is well circumscribed. Goal sa hai, ball-like. It is encapsulated, and this is the light microscopic image. These are the glandular structures. These are the mammary glands or the mammary ducts. Fibroadenoma breast mein hota hai. So these are the glandular components. So this is the fibrous tissue component. Fibroadenoma. It is a combination of two words. A fibrous tissue, this is the fibrous tissue which is the supporting stromal component, and adenoma means gland-like. Ye aap dekh lo, these are the gland-like structures. These are the gland-like structures. ये सारे ग्लैंड लाइक स्ट्रक्चर्स हैं. यहाँ पे ग्लैंड लाइक स्ट्रक्चर्स स्लिट लाइक स्ट्रक्चर्स में कंप्रेस हो गए बाय द सपोर्टिंग स्टोमा. सो दिस इज द फाइब्रोएडेनोमा composed up of two components. Fibroadenoma. This is a benign tumor of the breast forming glandular structures. Now this is a papilloma. This is a papilloma, finger-like projections. ये एक, दो, तीन papillomas हैं. This is a finger-like projection. और finger-like projection के core के अंदर there is a fibrovascular core, and this is covered with, because it is a squamous papilloma, it is covered with stratified squamous epithelium. बिल्कुल finger-like है आप देखिए. इससे भी ज़्यादा अब next diagram अच्छा. Now this is a squamous papilloma of the conjunctiva. This is the core. ये बिल्कुल finger-like projection है. This is the fibrovascular central core, and this is covered with hyperplastic stratified squamous epithelium. So this is a squamous papilloma. Now these are polyps. Polyps are rounded. I told you they are rounded ball-like nodular structures. So this is the endocervical canal. ये cervix है हमारा. ये cervix है, ये vagina है, और ये cervix के अंदर से ये दो pedunculated polyps project कर रहे हैं. So this is an endocervical polyp. This is the cervical canal. This is the vaginal wall. This is the cervical canal. This is the external os of a female. External os is the entrance of the uterine cavity. These are two polyps hanging out from the external os. Now, this is a pencil diagram showing this is a pedunculated polyp. ये इसकी stalk है और ये polyp है. Colon में polyps are very, very common. This is a pedunculated polyp of the colon, and this is a sessile polyp. A sessile polyp does not have a stalk. So these are known as sessile polyps. These are pedunculated polyps. Pedunculated polyps, I told you, they appear as mushroom-shaped outgrowths, and they are projecting into the hollow viscus of the colonic cavity. So this is a pedunculated. ये light microscopic image है of the colon. अब इसमें आप देखो hundreds of thousands of polyps होते हैं. ये familial adenomatous polyposis colon का patient है. इसके अंदर hundreds of thousands of polyps. And this is a polyp. This is a pedunculated polyp, a mushroom-shaped outgrowth. This is a sessile polyp. ये दो sessile polyps हैं. ये हमारे ये भी sessile polyp है. ये जिसकी बड़ी सी stalk है. This is a pedunculated mushroom-shaped outgrowth, और ये होती है यहाँ पे होगी lumen of the colon. This is the lumen of the colon. ये कोलन के मस्कुलर लेयर्स, ठीक है। यहाँ पे बाहर सिरोजा है, दिस इज द ल्यूमिनल एस्पेक्ट, एंड दीज पॉलिप्स आर प्रोजेक्टिंग इनटू द ल्यूमेन ऑफ द कोलन. This is another colonic polyp. This is the stalk of the polyp, and this is a colonic mushroom shaped lesion. ये इसकी stalk है, this is a pedunculated polyp. ये colon और stomach में बहुत common है. Now this is an endometrial polyp. ये endometrial cavity है हमारी, ये pencil diagram है. ये दो ovaries है, ये fallopian tubes है, ये हमारा vaginal vault है, ये endosphincter है. This is the cavity of the uterus. ये fundus से हमारा एक pedunculated polyp project कर रहा है into the cavity of the uterus. Now this is another pedunculated polyp which is projecting into the endocervical canal. So this is an endocervical polyp, and this is an endometrial polyp. These are two polyps, ये pedunculated polyp. Now this is a surgical specimen. This is a cut open section of a uterus, and this is a polyp hanging from the fundus of the uterus. This is the gross image of an endometrial polyp, inner lining endometrium. So this is the wall cut section of a uterus. The endometrial polyp hanging from the top, that is the fundus. Fundus जो होता है वो उसका top. This is the cavity, hollow cavity. Now this is a light microscopic image of a pedunculated polyp of the endometrium. Now this is a villus papillary. These are papillary structures having, this is a papillary adenoma or a papillary villus adenoma of the intestine. ये आप देख रहे हो finger like projections. ये बाद में हम दोबारा. Now the gross features, हमने malignant features, हमने benign tumors के सारे features कर लिए हैं. Now we come on to the gross features of a malignant tumor. Malignant tumors are cancers. They are, अभी आपको कुछ features मैंने बताए हैं. We can repeat them. That the gross means naked eye features. They are invasive, infiltrative, rapidly growing tumors. They cause destruction of the neighboring structures because of invasion and infiltration. They are poorly circumscribed. They do not have a capsule, and it becomes difficult to enucleate them because ये infiltrative होते हैं, invasive होते हैं, capsule नहीं होते हैं, poorly demarcated होते हैं. तो जब हमने इनको निकालना भी होता है, it becomes very difficult because they have insinuated into the surrounding tissues like a crab-like lesion. बिच्छू की तरह surrounding tissues के अंदर penetrate हो गए, and they are locally infiltrative, invasive. They spread into the surrounding neighboring normal tissue. Other features are benign tumors में हमने कहा था, they are well differentiated and they resemble the original tissue of origin, but malignant tumors are less well differentiated, or they are completely undifferentiated anaplastic, and they lose their original resemblance to the parent cell of origin. They lose their original functional and morphological appearance to their parent cell of origin. They acquire certain unexpected and new functions which previously they did not possess. For example, they start producing certain unknown substances. They may start producing certain unknown hormones, ectopic hormone production. In fact, they are not endocrine organs. Endocrine na bhi ho, they start producing certain ectopic hormone substances, and these are known as the paraneoplastic syndrome. ये हम बाद में करेंगे. They spread to distant organs, like that is known as metastasis. एक तो वो locally invasive होते हैं, इर्द-गिर्द फैलते हैं. दूसरे they spread to different organs, different sites away from their original जहाँ पे उनका original parent area था, वहां से दूर जगहों पे पहुंच जाते हैं. Like they can spread to the lungs, they can spread to the bones, they can spread to the liver. That is known as distant spread, and distant spread which is far removed from the original location of the tumor is known as metastasis. Metastasis and infiltration or invasion are the two hallmarks of malignant tumors. They are lethal. They can cause death of the host, and even if you remove them after surgery, they are prone to repeated local recurrences because they have sent their feet or their अपनी जड़ें इन्होंने जैसे बिच्छू अपनी जड़ें इर्द गिर्द भेज देते हैं, इसी तरह they are prone to repeated local recurrences because they cannot be completely enucleated because they do not possess a well-formed capsule, and complete removal is usually not possible because of their invasive infiltrative growth. So invasion, local invasion and distant mets. So invasion and infiltration is always local, and metastasis is always to some distant site in the body, are the two main cardinal hallmarks of malignant tumors. Invasion and metastasis. Now, remember two definitions. What is a sarcoma and what is a carcinoma? A malignant tumor of mesenchymal origin is known as a sarcoma, and a malignant tumor of epithelial origin is known as a carcinoma. ये वाइवा में पूछते हैं sarcoma क्या होता है और carcinoma क्या होता है. A malignant tumor of mesenchymal origin is known as a sarcoma, and a malignant tumor of epithelial origin is known as a carcinoma. A mesenchymal origin sarcomas के examples are liposarcoma. इसका benign component was known as the lipoma. Malignant counterpart is the liposarcoma. Fibroma, malignant counterpart is known as fibrosarcoma, chondrosarcoma, osteosarcoma, leiomyosarcoma. Liposarcoma का benign component was the lipoma. Fibrosarcoma का was fibroma. Chondrosarcoma का benign counterpart was chondroma. Osteosarcoma का osteoma and leiomyosarcoma का क्या था? Leiomyoma. इसी तरह हेमेंजियोमा का हम एंजियोसार्कोमा हो जाएगा. Now, epithelial origin tumors are called carcinomas. And examples of carcinomas are those that form glandular structures are known as adenocarcinomas. So, adenocarcinoma is a malignant epithelial tumor forming gland-like structures. For example, we have an adenocarcinoma which can be seen in the stomach, colon and endometrium. All those structures जिनको हिस्टोलॉजी में जिनके अंदर ग्लैंड्स हैं, उनमें जब malignancy develop होगी तो they are going to form what are known as adenocarcinomas. A squamous cell carcinoma is a malignant epithelial tumor of squamous origin. It shows squamoid cells and keratin. और squamous cells हमारे आमतौर पे कहाँ पे होते हैं? सबसे ज्यादा हमारा squamous cell is the skin, cervix और भी बहुत सी जगह esophagus में squamous lining होती है. तो इनके जो malignant epithelial tumors होंगे, they are going to be known as squamous cell carcinoma of the skin or squamous cell carcinoma of the cervix. Then we have another malignant tumor that is known as lymphomas. Lymphomas are solid malignancies of the lymphoid tissue. Like lymph node का जो malignant tumor होगा उसको हम कहेंगे lymph node का benign tumor नहीं होता. Lymph nodes का benign tumor नहीं होता. Reactive conditions lymph nodes में हो सकती हैं, लेकिन lymph node में invariably we have malignant tumors and they are known as lymphoma. So lymphoma, as the name indicates, it is a solid malignancy of lymphoid tissue. Leukemia is a liquid malignancy of the blood cells. जो भी हमारे blood cells होंगे, lymphocytes होते हैं, हमारे plasma cells होते हैं, हमारे neutrophils होते हैं, हमारे monocytes होते हैं. तो monocytes, monocytic leukemias होंगे, red blood cells के origin के tumors होंगे जिनको हम कहेंगे myeloid leukemias. फिर हमारे पास होंगे lymphoid tumors के हमारे होंगे chronic lymphoid leukemias होंगे, lymphoblastic leukemias होंगे, सारे leukemias. Then the fifth category are the poorly differentiated or the undifferentiated malignant tumors. Now they are known as poorly differentiated or undifferentiated because they are so undifferentiated that we cannot tell whether they are of the origin. It is not known whether we can classify them as of being of epithelial origin or of mesenchymal origin. So these are known as the poorly differentiated or the undifferentiated malignant. So we have the mesenchymal origin tumors called sarcoma, epithelial origin tumors called carcinomas, lymphomas, solid tumors of lymphoid origin. Then we have the leukemias, which are liquid malignancy of blood cells, and then we have the poorly differentiated. Now this is an adenocarcinoma. Adenocarcinoma is an epithelial origin malignant tumor. Adenocarcinoma, you can see that this is forming it is forming gland-like structures. This is a well differentiated adenocarcinoma because इसमें आपको समझ आ रहा है कि these are glands. This is another diagram showing a well differentiated adenocarcinoma. ये glands. These are glands. This is a well differentiated squamous cell carcinoma. ये squamoid cells हैं forming keratin pearls. Keratin pearls और squamoid cells बहुत अच्छे हमें नजर आ रहे हैं. That's why we say this is a well differentiated keratinizing squamous cell carcinoma. We can appreciate that these cells are of squamoid origin. Now this is a lymphoma. This is a gross picture of a malignant tumor of lymphoid origin. These are matted and large lymph nodes. This is a lymphoma, gross image of a lymphoma. These are malignant, this is a light microscopic image of the lymphoma. Small round blue cells. बिल्कुल जैसे lymphocytes होते हैं. छोटे एक तरह के blue color. This is another lymphoma. This is another light microscopic picture of a lymphoma. Then we have mixed tumors. ये heading बेटा बात सुनो, ये heading मेरी छुप जाती है. Now mixed tumors. This is a special category of tumors. उनको आ रही हो? अच्छा. Now we have mixed tumors. Mixed tumors are a special category of tumors which tend to show divergent differentiation, meaning that these cells are capable of differentiating both into epithelial components as well as mesenchymal. So they are composed of a mixture of both epithelial and mesenchymal components. So we have a mixed tumor of salivary gland, which is a pleomorphic adenoma. It is composed of a mixture. ये इसका पॉइंटर इधर ले आओ. इधर. So we have a बेटा बता दो. मैंने इधर ला. जी मैम इधर. कैसे? थोड़ा पहले ही दे रही हूँ. किधर? जब आप ज़्यादा डिस्कस करेंगे. अच्छा. Mixed tumor of salivary gland, it is known as a pleomorphic adenoma. Then we have बेटा ये अच्छा. Then we have an adenosquamous carcinoma. An adenosquamous carcinoma is a combination of both glandular components and squamous cell. Both malignant components are of epithelial. Glands भी हैं और ये भी. ये आप अपने लेवल पे कलर रहने दो. This will be too much for you. So carcinosarcoma is a tumor which has it is a biphasic tumor composed of both components, mesenchymal malignant components and epithelial malignant components. Both components are malignant. An example is the mixed Mullerian tumor of the uterine cavity. It is known as a carcinosarcoma. Carcinoma is a malignant tumor of epithelial origin, and sarcoma is a malignant tumor of mesenchymal origin. So carcinosarcoma is a tumor containing both malignant epithelial components and malignant mesenchymal. Then we have teratomas. अब ये teratoma, choristoma और hamartoma तीन definitions आपको आनी चाहिए. A teratoma is a tumor composed of a mixture of various tissue types, which may be mature or immature, derived from more than one germ layer. Germ layers होती हैं हमारी endoderm, mesoderm and ectoderm. तो अब तीनों germ layers से जो tumor arise करेगा, that is known as a teratoma. And teratomas, they originate from the totipotential germ cells. So a teratoma is defined as a tumor which is composed of a mixture of various tissue types derived from more than one germ layer or from all three germs. And teratomas may be of two types. Those which occur in the gonads, that is the ovary and the testes, are known as gonadal teratomas. And those which occur at the extragonadal midline structures are the extragonadal type of teratomas, and they occur in the sacrococcygeal region, known as the sacrococcygeal teratoma. They occur in the midline of, that is the mediastinum. Then they can occur in the head and neck and brain region. So these are the extragonadal teratomas which occur in the midline structures, and the gonadal teratomas, they occur in the ovary. On morphology, the teratomas are, because they contain tissues from more than one germ layer, grossly inmate. The most important component which helps in their identification is the presence of hairs. Grossly, आपको बाल नजर आ जाएंगे, teeth, bone, fat, cartilage, skin, nerve, muscle, ये सब आपको grossly नजर आ जाएगी. And on light microscopic examination, you are going to find epidermis, skin composed of stratified squamous epithelium. You are going to find sebaceous glands, hair follicles, brain tissue, fat tissue, bone tissue, cartilage, dental enamel of tooth, intestinal epithelium, thyroid नजर आ जाएगा, खास तौर पे ओवरी के अंदर thyroid के follicles containing colloid नजर आ जाते हैं. Then you can find respiratory stratified squamous epithelium, ciliated epithelium, and you can find the pigmented layers of the retina. So the dermoid cyst is a teratoma of the ovary. It is seen most commonly, it is a benign tumor, it is most commonly seen in the ovary, and it contains, इसको हम dermoid cyst इसलिए कहते हैं because इसमें predominantly differentiation होती है along the ectodermal cell line. Ectodermal germ layer की तरफ predominantly differentiation होती है, not towards the mesodermal or the endodermal components. इसमें mainly आपको skin नजर आएगी, आपको बाल नजर आएंगे, pilosebaceous units and tooth structures. So an ovarian teratoma, a benign cystic ovarian teratoma, that is the dermoid cyst, it is invariably benign, called a cystic teratoma or a dermoid cyst, and it differentiates mainly along the ectodermal cell. On the other hand, these are the ovarian teratomas called the dermoid cyst. Testicular teratomas are usually malignant, and malignant teratomas, यानी कि testes के जो teratomas होते हैं, they are usually malignant and they are known as immature teratomas. Ovary के जो teratomas होते हैं, they can also be malignant, but जो dermoid cyst होती है वो होती ही नहीं. Testes के जो जितने भी teratomas होते हैं, ज़्यादातर they are malignant. So this is a gross image of an ovarian teratoma. इसको ovary की cyst थी जिसको हमने काटा है, इसके अंदर ये आपको बाल नजर आ रहे हैं. This cheesy material. This is an ovarian cyst containing dirty cheesy material, और ये black cyst structures, and these are entangled hairs. This is another ovarian teratoma. ये इसमें से बाल नजर आ रहे हैं. They can be solid or they can be cystic. Now this is another ovarian teratoma, and you can see इसके अंदर ये आंख नजर आ रही है, eyes बनी हुई है, and these are teeth. This is an ovarian teratoma showing multiple teeth, और ये आपको eyeballs दो नजर आ. Now this is an ovarian teratoma light microscopic image which has predominantly differentiated along the intestinal epithelium. ये बीच में म्यूसिनस सिक्रीशंस हैं और ये गॉबलेट सेल्स. This is another teratoma showing ये bone है, ये marrow है और ये sebaceous glands है और ये हमारा respiratory columnar ciliated epithelium. Sebaceous tissue है इसमें bone है, इसमें marrow. This is a dermoid cyst of the ovary. ये आप देखो, this is stratified squamous epithelium. These are the pilosebaceous unit. ये sebaceous glands. So this is a dermoid cyst of the ovary, light microscopic image of a dermoid cyst of the ovary. Now, what is a hamartoma? Hamartoma and choristoma are two important terms which you should understand. These are mainly considered to be tumor-like malformations. इसमें ये होता है hamartoma में haphazard mixing हो जाती है mature tissues की, which are indigenous to that particular organ. उसी area के mature tissues हैं, लेकिन they are not present in an organized manner. जैसे आपको पता है intestine में 4 layers होंगे, ठीक है, म्यूकोजा होगा, सब म्यूकोजा होगा, फिर हमारे मस्कुलर लेयर होगा, ये सारे लेयर्स होते हैं. अब हमाटोमास के अंदर ऑर्गेनाइज्ड तरीके से चीजें नहीं पड़ी होती, होंगी उससे मेच्योर होंगी, लेकिन दे आर गोइंग टू बी अरेंज्ड इन अ हैपहैज़र्ड disorganized manner. So they are disorganized benign masses composed of cells which are native or indigenous to that particular site. All the constituent cells are mature, but they are arranged in a jumbled up, haphazard arrangement of mature differentiated tissue elements which are indigenous to that specific tissue or organ. For example, we have a lung hamartoma. They are mainly considered to be developmental abnormalities. So this is a gross image of a pulmonary hamartoma. ये lung है, ये gross image है, ये lung है, ये blackish ये spongy सी lung है, और ये इसके अंदर white सा hamartoma है. Hamartoma में the main component is cartilage. आपको पता है ना, जो हमारा respiratory passages के जो main हमारे bronchial epithelium के जो main हमारे trachea and the main bronchi के अंदर C-shaped हमारे cartilage components होते हैं. So this is cartilage, and these are the cleft-like spaces. This is cartilage, and they are not arranged in a organized manner. ये respiratory epithelium आपको नजर आ रहा है. This is also respiratory epithelium. ये सारा respiratory epithelium है, but it is arranged in cleft-like spaces and it is forming a mass. This is another image showing chondroid tissue, cartilage, adipose tissue, and the respiratory epithelium. So this is a pulmonary hamartoma. Then we come on to a choristoma. A choristoma is a focus of ectopic tissue. यानी कि ये बिल्कुल उसका ऑपोजिट हो जाएगा. जैसे हमाटोमा, पल्मोनरी हमाटोमा का ये ऑपोजिट हो जाएगा. इसमें आइलैंड्स ऑफ नॉर्मल मैच्योर सेल्स होंगे, but they will not be located in their original area. They will be located at some removed far away site. So these are ectopic tissues or ectopic rests or islands of normal mature cells, but they are located in an abnormal location. For example, kidney के कैप्सूल के ऊपर आपको एड्रीनल आपको किडनी के अंदर आपको एड्रीनल टिश्यू मिल जाए, wall of the small intestine या gall bladder या stomach के अंदर आपको pancreatic tissue मिल जाए, gastric tissue के अंदर wall of the small intestine या Meckel's diverticulum के अंदर आपको parietal cells, gastric tissue मिल जाए. So these they mimic a neoplasm. So both hamartomas and choristomas are not true neoplasms, but they are considered to be developmental or tumor-like anomalies. So to summarize, a hamartoma is a benign tumor or a tumor-like lesion which is composed of mature tissue, but it is present in a disorganized. For example, a hematoma of the lung, it consists of mature cartilage, smooth muscle cells and epithelium, but they are not present in an organized 3-layer pattern. इसी तरह जो कोरिस्टोमा होता है, it is ectopic islands of normal tissue which is located in an abnormal tissue. Ectopic islands of normal tissue located in another tissue, another organ. जैसे अभी हमने एग्जांपल किया कि पैनक्रियाटिक टिश्यू आपको वॉल ऑफ द इंटेस्टाइन के अंदर मिल जाए, वॉल ऑफ द गॉल ब्लैडर में मिल जाए, वॉल ऑफ द स्टमक. सो दिस इज अ लाइनिंग ऑफ अ गॉल ब्लैडर. ये गॉल ब्लैडर की लाइनिंग एपिथेलियम है, एंड दिस इज पैनक्रियाटिक टिश्यू लोकेटेड इन द वॉल ऑफ द गॉल ब्लैडर. ये गॉल ब्लैडर की लाइनिंग है और इसके अंदर ये पैनक्रियाटिक टिश्यू है. सो दिस इज जस्ट समरी. टेराटोमास क्या होते हैं? ट्यूमर कंपोज्ड ऑफ cells derived from more than one layer, germ layer. They arise from the totipotent germ cells, and they are the gonadal teratomas, and the benign cystic teratoma of the ovary is the most common teratoma. जो टेस्टिकुलर टेराटोमास होते हैं वो आमतौर पे इमेच्योर होते हैं, और इमेच्योर टेराटोमास आर यूजुअली मिले. फिर ये ट्यूमर्स विद एबेरेंट डिफरेंशिएशन आर द हेमाटोमास एंड द कोरिस्टोमास. ये भी आपको डिटेल में मैंने बताया. सो मिसनॉमर्स, अब हेपाटोमा, मेलानोमा, सेमिनोमा, लिम्फोमा और मेसोथेलियोमा, ये आर मिसनॉमर्स. हेपाटोमा जब हम कहते हैं ऐसे लगता है जो बिनाइन ट्यूमर ऑफ हेपेटिक ओरिजिन है, लिवर का, बट it should be more appropriately be called a hepatocellular carcinoma. Hepatoma is a malignant liver. ये misnomers हैं, so they should not be used. They should be appropriately be called a malignant tumor of the liver. Should not be called a hepatoma. It should be called a hepatocellular carcinoma. A malignant skull tumor, which is known as a melanoma. It is a malignant tumor. It should be called a malignant melanoma. A seminoma is a malignant testicular tumor. A lymphoma is a malignant tumor of lymphocytes. ये सारे malignant है. Mesothelioma, ये misnomers हैं. They are malignant tumors of the pleura or pit. अब एक और entity है that is known as the blastomas. Blastomas or embryomas, they are known as the small round blue cell tumors of infancy and childhood. As the name embryoma indicates, or blastoma. Blastoma हमारे eggs का फिर blastocyst stage embryoma, आपने embryology में पढ़ा होगा. So blastomas or embryomas are always malignant. They are also known as the small round blue cell tumors of infancy and childhood. They usually occur in infants and children which are less than 5 years. Examples of blastomas or round blue cell tumors include neuroblastoma, which is a tumor of the adrenal medulla. It is a malignant tumor of the adrenal medulla. Nephroblastoma is a childhood malignant tumor of the kidney, also known as Wilms tumor. Retinoblastoma is a malignant tumor of the retinal epithelium seen in children. Medulloblastoma is a brain tumor. बेटा ये बंद कर दो. ये लास्ट थोड़ा सा रह गया था, ये कनेक्ट हो सकता है? नहीं, वो आ नहीं रहा. So we have a lymphoblastic lymphoma. This is a lymphoma. It is a malignant tumor of lymphoid origin. Burkitt's lymphoma is a malignant, another lymphoma which is a malignant tumor, but ये सारे बच्चों. Pancreatoblastoma is a malignant tumor of the pancreas. Pulmonary blastoma is a malignant tumor of the lung seen in children. Embryonal rhabdomyosarcoma and desmoplastic small round blue cell tumor. वाइवा में आमतौर पे आपसे पूछ लेते हैं कि name the round blue cell tumors of infancy and childhood. So जितने भी राउंड ब्लू सेल ट्यूमर्स हैं, दे आर द ब्लास्टोमास और द एम्ब्रियोमास. 4-5 का नाम याद रख लो. न्यूरोब्लास्टोमा, नेफ्रोब्लास्टोमा, रेटिनोब्लास्टोमा, हेपेटोब्लास्टोमा, पैनक्रियोटोब्लास्टोमा, पल्मोनरी ब्लास्टोमा. किसी भी ऑर्गन का नाम ले लो और उसके आगे ब्लास्टोमा. So that completes your list of blastomas. आपका लेक्चर आ जाए. सॉरी मेरा लेक्चर थोड़ा सा लेट हो गया था बिकॉज इंटरनेट का बहुत इशू. थैंक यू. ये मेरी फ्लैश उतारते हैं जी.